much. We have more questions from the Balkans. We may come back to them later. Let's go now to India. Do we have someone from India today?
And that's Hi, my name is Ankit Kumar. I represent India today.
Yes, Ankit, please go ahead.
My question is, is the World Health Organization been tracking the developments in India? How will you comment on the progress made by India in the first week of lockdown, and how do you assess the results so far? Thank
you. I think it's a little early to assess the results of the lockdown, but I think we need to step back and assess the results of the response in general. Lockdowns and shutdowns are really should just be part of an overall comprehensive strategy. And what we need to be able to do as societies, and with the leadership of an all-of-government approach, is to be able to implement a consistent policy for a period of time, and then see where that takes us, and then measure and see what we need to do next. We need to be very careful not to knee-jerk. We need to be very careful not to be changing policies every single day, because people on the front line need certainty in their days. Communities need some certainty. So it's really important that we are very consistent in our communication with communities and our frontline workers about what we do. And we need to give clear messages about what we do for the next week or the next 2 weeks. And we need to then be clear when we're going to evaluate the impact of that period of intervention. And then if we have to change, we change, and we communicate that clearly. And then we do it again for another 2 or 3 weeks, and then we see how that works. And then we gather the information, and we consult with our frontline workers, and then if we have to adjust or change. This is about adapt, adjust, implement, measure, do it again. And you just have to keep doing that over and over and over again until you control the disease. I would love to say that there's an easy way to do this. I would love to say that there's a way out of this without that kind of hard work, but there isn't. We have to be comprehensive. We have to measure everything we do. We have to measure at below the national level. And then, if we have to use lockdown, if we have to use shutdowns, we do them as part of an overall comprehensive strategy. I would say India, and as the Director General has said in his speech, has made a really huge attempt to limit the impact of the shutdowns on the people who are most at risk and people who are most vulnerable in India, and that's a great thing to see. We see increase in testing, we're seeing an increase in surveillance, and we're seeing an investment in the healthcare system to be able to deal with more cases. But it is certainly too early for anyone to determine the impact of the shutdown or lockdown measures on disease transmission at this point.
Thank you, Mike. I mean, the health issues are very important, as Mike said. I would like to add the other side. As you know, this is the first ever coronavirus pandemic in the world, meaning there are many unknowns. And whether we do shutdowns or take other measures, we have to understand that we're in a learning process. We have to constantly learn from our actions and adjust based on what we learn. But I would like to again underline, this is the first ever coronavirus pandemic, and its behavior is still unknown. And that's why we should always be in a learning mode. The other part is not only the public health measures during shutdown, but it should be the social and economic factors that we should consider. And what India is doing, as I said in my statement, is very, very important. During shutdowns, there will be economic consequences on the country at large, but more importantly, individuals who live on daily subsistence, who give their labor for their daily bread, could be affected the most. And that's why India is taking measures like the $24 billion US package. And not only that, this will cover 800 million individuals as food ration during the difficult times, and cash transfers to 204 million women. And of course, 80 million households will also benefit for the next months from getting free cooking gas. That's the kind of support we said it should be given. So we should not see it from the public health part alone, but see it from the angle of what the consequences of these public health measures will be on the community, and try to support our citizens. And this should be seen during these difficult times, during the lockdowns as so-called, and that's how we can get the best impact, but at the same time cooperation from our communities too, because if we understand and try to help them. But there was another important element I mentioned in my presser today, because it's very important, I'll repeat it. Many countries, many developing countries, cannot really support their society, especially during lockdown, especially on those community members who work for their daily breads. And that's why we called on the international community to have a debt relief to support those countries. But as you also know, debt relief processes are actually lengthy. But what we're proposing together with the World Bank and IMF is an expedited process to support countries so their economy will not be getting into crisis and their communities will not be really getting into crisis. This is a time when we need solidarity, not only for public health, but also to address the economic and social challenges that many countries are facing as we speak. I will repeat with what I started. This is a pandemic for the first time caused by a coronavirus and whose behavior is not really known, and we have to stand in unison to fight this unknown and dangerous virus.
Just wanted to supplement with what Mike and Dr. Tedros has said. And one of the things that we are working very hard on is to systematically assess the response actions that are being taken by countries. As Dr. Tedros has just said, this is the first pandemic of a coronavirus, and it's important for us to critically look at what countries are doing so that we can assess these and see which actions have worked best and which combination of these have worked best. And there's a lot of factors that go into this that relate to this comprehensive approach that we've been talking about. So, for example, what are the testing strategies that countries are using, and what is the percent positive that they're seeing in terms of the numbers of tests that they've done? What is their surveillance strategy? How are countries looking for cases? Are they looking at suspect cases and contacts? Are they trying to identify additional cases through existing respiratory disease surveillance systems like their ILI or their SARI surveillance systems? How are the public measures being applied, and when and where? What movement restrictions are put in place, when and where and for how long? How are our governments and leaders communicating with their populations, with their people? What type of support is being provided to communities? And how are we innovating, and how are we conducting research to learn and feed that back into the response? All of those things need to be done at a national level and at subnational levels to look and see which actions are the most effective. We have evidence from Asia in terms of a number of countries now that have broken this down to subnational levels to look at what has been done where. And what we've been saying about aggressively looking for cases, testing suspect cases, finding contacts, quarantining contacts, isolating patients, and caring for them depending on their severity, those work. But we also need to continually assess what is being done as this pandemic moves across the globe so that we can build up that evidence base to show what works and to make sure that countries have a tailored approach